Okay, so good evening, everybody. Welcome to my IVF answer by the European Fertility Society. I'm Elena and I am a medical assistant in Barcelona IVF. We're going to start in a second. I'm going to put here everything. So we're going to speak about IVF in patients behind their 40 years today. We're going to start the presentation. Before everything, I want to remember and I want to inform you that the presentation of today is recorded, even if it's all anonymous, and then you can see the recording tomorrow. In the YouTube channel and also in the page, of my IVF's answer. We're going to start with presentation in a second, and then at the end, we're going to do a moment of question and answer together. So by the moment, if you want, while I speak, while I do the presentation, you can leave your question in a part of the chat. Then at the end, we're going to answer together. Enjoy. We'll start together. As I was commenting today, topic of today's IVF in patient beyond day 14. I'm Elena I was commenting, and I'm from Barcelona IVF. And we're a clinic located in Barcelona, and here you can also see our contact. We're going to speak a little bit about the clinic, how you can get in contact with us, the treatment that we offer in the clinic, the laboratory, how it works when you do a treatment abroad. Then we're going to start speaking about the topics of today, which is PGT testing in IVF over 14 years, egg donation, and then, as I was saying, we have a little moment for question and answer. So let's start. This is the same, it's just a sum up. We're going to start speaking about the clinic. We have a special team of professional and specialized doctors committed totally to your care. And the thing that we want always to transmit to our patient is that we want to walk with you during your journey, and we want you to achieve the goal. We have all the same goal, help you with the building of your family. And we always want to follow you with excellence, closeness. We have a special and advanced reproductive medicine, a special laboratory, and a specialized professional team. I want also to underline that, as I was saying, we're going to support you. We're going to help you. We're going to take into account your hopes, wishes, dreams. You will never be alone during the journey, and you're going to have a 24/7 contact with the clinic. The clinic never closes, so for anything, any emergency you could have, you can always contact with us, and you can always count with us. We want you also to transmit that we have and we strive for continuous improvement, and we want to keep going with excellence. And everybody knows that in IVF the path is difficult, but we're going together. So how do you get in contact with us in the moment that you decide to do not a treatment directly, but maybe a first consultation? You can talk to us through email, through phone, or directly on our website form. With a quick response, we have 24 hours per response. And in the first moment, you will have a patient assistant that will help you with the first contact. We call it in this way, and to schedule the first video visit with one of our specialized doctor. We can organize an in-person visit or an online visit. Since we're speaking about doing IVF abroad, we know that maybe it's not that easy to come for like a lot of time. So we try to organize everything online. Well, at least before doing the IVF or the transfer, all the content can be online. We can do an appointment when you prefer. And also before organizing the visit, we're going to ask you if you have any test results available. In order to that, we will send it to the doctor before, so the doctor can already have a first view of your history and check with you together and check with you how we can arrive to our goal that I was saying before, which is motherhood. Also, during the visit, the doctor will review your history, maybe depending on what you did before, if you did any other treatments. So we'll ask you to do other tests to check like better your situation. Once that we have all the tests done, we can do a personalized treatment protocol in order to go on. The important thing to underline is that all our team is composed of people who speaks a lot of languages, and they're specialized in IVF reproduction. We can help you during the treatment. We can help you on the first part of organizing the visit. Once that you start the treatment and you have all the protocol, then we're going to help you with, for example, the medicine, the injections, and all maybe the little doubts that you can have during the journey. We're going to be there, like as I was saying, almost 24 hours because the clinic never closed, and you have also an emergency contact to call if you need anything during the time, and you will always be followed by the international team. We'll also count with a state-of-art vitro fertilization laboratory. It allows us to increase the pregnancy rates due to apply the best technology and latest medical advances. So what we do in Barcelona IVF, we can offer different type of treatments like artificial insemination, in vitro fertilization, egg donation, embryo donation, and proper method. At the same time, we can combine our treatment with the texts that we use with in the laboratory, which can be ICSI or MC, and this would depend on the diagnosis of the doctor. We use the blastocyst culture because it improves the pregnancy rate. Blastocyst culture means that we leave the embryo after the fertilization to arrive to blastocyst stage. During this time, we can use an embryoscope, which is the third point that we see here, and it is a special time lapse that takes a photo to the embryos. And this way, we can see the development of the embryos during these days. Then we can use the PGT, which is one of the topic of today, which is a pre-implantation genetic test that detects genetic abnormalities. We're going to see together after a little bit more about it. Then we can count with the sperm donor. We work with different banks, sperm bank, and the IDA score, which selected the highest implantation potential. So here we are, and we arrive to the part of the topic of today, which is PG testing and IVF over 40 years. The first part is that IVF, in vitro fertilization, is an assisted reproduction treatment where the eggs are fertilized with sperm in the laboratory. What happened that once that we have the blastocyst, means that they arrive to blastocyst stage. The thing that we've seen before, we'll leave them developing during the days. And when they arrive to blastocyst, normally it's the 5th day, but it depends. We proceed with the PGTA testing, who detects genetic abnormalities in the embryo before during the transfer. As you can see in the imaging, we do the IVF, we make it develop, we do the biopsy, so we take like a little piece of the embryo. We analyze the piece that we threw with biopsy, and the other part is frozen. I mean, the complete embryo is actually, not the other part. Waiting for the result. Once that we have the result, if the embryo is chromosomically normal, the euploid, we can do the transfer. What is PGTA? Also, and why should we indicate to use PGTA in some cases? As I was saying, the PGTA is a biopsy. Instead, we take the embryo, we take a little part of the embryo, and we analyze it. We analyze the DNA, and we see if there is any chromosomal abnormalities. We have more option when we have the result. A number can be euploid. It means that there are no chromosomal abnormalities detected, so the embryo is good and we can transfer it. Or we can detect that there are some abnormalities like trisomy, monosomy, and then can be more dependent on the result. And in this case, the embryo would be aneuploid, so it wouldn't be possible to transfer it. Why we should indicate to use PGTA? On the topic of today, we suggest to use PGTA, on women over 40 undergoing IVF, but is also used in other cases like an of recurrent miscarriage, a previous IVF failure. Sometimes also there can be a masculine factor. So taking into account all this details, we can indicate and suggest to do the PGTA. What happened when we use the PGTA, which is the benefit of using it in these cases? The first is that we shorten the time to pregnancy. We reduce the risk of miscarriage, and we also improve success rate per embryo transfer because we are sure that the embryo is euploided. There are no chromosomal abnormalities. And taking into account the first point that we were commenting on the indication and suggestion, I would say why PGTA in women over 40. We have some indication, and then we have some points that we like underline for this. The first is that a woman that decides to do an IVF over 40 years has an increased risk of chromosomal abnormalities. Even if we would like to feel young always in the advancing maternal age, the egg quality can diminish a little bit, and this can lead to a higher likelihood of chromosomal abnormalities, so aneuploidy, and this is what we were talking before. Instead, we can have a trisomy or monosomy or other things that can be detected, and we wouldn't be good to be transferred. Also, we have a lower natural implantation rates. The embryos with chromosomal abnormalities are less likely to implant successfully in the uterus. And also, when we have an aneuploid embryo, we have a higher miscarriage rates because aneuploid embryos normally lead the first trimester miscarriage, which is normally more common in women over 40 years. It doesn't mean that it's going to happen to everybody, but there is like a higher miscarriage rate. And then we have improved the IVF efficiency because with the PGTA we use it to identify the most viable embryo, and we can potentially reduce the number of IVF cycle, so the time to get the pregnancy. And these are the main points: so increased risk of chromosomal abnormalities, lower natural implantation rate, high miscarriage, improve. Every day we have the possibility to see which embryos are good to be transferred, and we can improve everything. But what happened a certain point when we see maybe that we have been doing IVF, we've been also doing PGT test, TGTA test, and mm, we decide at a certain point that we want to have higher possibility. Obviously, this is not the only option. Obviously, it depends on a lot of things. It depends on the diagnosis, the history of a person during the IVF process. But another option that we can take into account is egg donation. What is about egg donation? Egg donation is an assisted reproduction treatment where the eggs from a donor are fertilized with a sperm or a partner or a donor in a laboratory. So it is a normal IVF, but with the eggs of a donor. We recommend it when a woman cannot achieve a pregnancy with her own eggs. So the thing is that I was saying before, it doesn't mean that it's strictly related to the age, even if it is one of the most common causes. We can have a poor quality of the eggs. We can have a low ovarian reserve, so an AMH, or we can have some genetic disorders. So at this point, we can arrive to decide to use an egg donor. How do you organize an egg donation cycle? The difference between egg donation and IVF about the time is that when you do IVF, you maybe should come just one time for the egg retrieval and for the transfer. You could do everything together. Obviously, if you decide to do the PGTA test, you should come twice, one for the egg retrieval and then one for the PGTA test. But in case of egg donation, we suggest to come twice to the clinic. The first time to organize the cycle and freeze the sperm if needed. If we decide that we want to do with a partner or not in this case, well, you should come just once for the embryo transfer. Obviously, you can come anytime you want to the clinic. There's no need to come just one or twice. You can come anytime to do also all the visit here. There is no problem at all. But normally for an organization thing, it will be one or two. Once that you and we decide that you're going to do an egg donation treatment, the doctor make you the diagnosis and all the protocol, and you will start getting synchronized with the donor. Once that you're synchronized, well, the patient would start an endometrial preparation. It means that we'll start to prepare the endometrium to receive the embryo once it's fertilized, once the egg of the donor is fertilized. So during this time, the preparation would include one ultrasound or maybe one more that can be done at the clinic, as I was saying before, or in your country or with your gynecologist or where you prefer. There's no need to come. When we choose a donor, we have like a special, I don't know exactly how to say this word, but I can say that we carefully personalize the choice because we start from the point I think that women are aged between 18 and 35 years old. They're in excellent physical and mental health. They must pass a strict medical, psychological, and genetic test. Once that we can say that the donor is good to be actually a donor, then we can do a match with the patient. So we do a matching with the patient, taking into account the physical traits, the blood type, and we'll personalize like the caring of the donor matching. We have a special department for this to take care of the donor, take care of this type of matching. So doing a little bit of sum up. When you decide to do an egg donation, you speak with the doctor. We organize maybe a first visit online and then a second in the clinic to leave the sample if needed, where we organize the cycle. And once that we decide, you start the synchronization because during this time also the department of the medical team that is specialized for the donor is choosing the donor. What happened when we selected donor? A part of the thing that they are in physical, excellent physical and mental health, and that they are good to donate, and this. We need to underline that the identities of the donor are totally protected in Spain. So the donor is totally anonymous, and the patient can receive some information related to it, can receive an information about the height, the color of hair, color of skin, like the physical traits, the blood group, and maybe sometimes the patient can get an extra info, but maybe it depends if the donor decide to do it, but you can maybe say some hobbies or part of personality or motivation, but they will be always covered by the law. So once that you do the transfer, you can have all the information of the donor and you can see that there is a matching with you. So it was quick. I hope that you liked the explanation. Obviously, now it's your turn. If you have any question, if something is unclear, or if you're curious about details, um, I see here that in the meantime, you left some question. Please, if you need like any details more, feel free to. So I'm going to read the first part. Would Sarah, thank you for your question. What is the live birth rate in New for women? Is it there or an exit 45? In Canada, where I'm from, it's for 5% or lower. Have a regular period and ovulation. Okay, so thank you so much, Sarah, for your question. The birth rate, it doesn't like depends only of the treatment, but it depends on the history of a person. So in this case, a doctor would do a diagnosis in your case, would analyze your history and your situation. If you want, you can get in contact with us and we can program a first visit. And during the visit, the doctor could give you like a better rate because it is something that is connected to the patient, is not something that we can directly give because there are like more things related to it. So if you want maybe to see your rate, you can contact us and we can organize a visit and we can discover it together. Then Karen, will you treat ICSI cycle if I don't want PGTA test embryos? I only ever get one, so we rather give a chance and transfer if good enough. Okay. Also, in this case, it depends on what happened during the stimulation. There are some cases in which if you have more embryos, the doctor can suggest you to do a PGTA test, analyze it, and then see the result. In some cases, maybe if you have only one blastocyst, depending on the cases, maybe the doctor could suggest you to transfer or to do a thing that we call embryo banking. So we can do more cycle to accumulate more embryos to test all together. And then once we have like a higher number, we can do the PGTA test, so the biopsy, and then once we have it, we can see the result, and depending on the result, then we can do the transfer. So actually, it also depends a little bit on what happened and what the doctor think, and also how your body reacts to the stimulation. Then we're going to see the next question. Sarah, do you help with accommodation when a couple travels to your clinic from another country? The answer is yes. We help. We do not directly help calling the accommodation, but we have a list of hotels and accommodation that we count with. In a case that you want to do the treatment with us, we can share with you the document where we have like a lot of author that works with us, so you can get also a discount. In this document you can see all these hotels and also the way that you can get a discount booking the accommodation. For example, it could be calling or via email or in a form of the hotel, but in any case, if you need anything, we can just give a quick call for you and we can help you with that. There's no problem at all. In the meantime, I see here you feel free just to make me more question. If you want, in the meantime, we can go back a little bit to the first part. So coming, here we go. You can see a little bit of the presentation. If you have any doubt, I can maybe make a little sum up and take some questions. And normally all the patients abroad ask the timing. The timing depends on the treatment that you decide to do. An IVF takes around, with PGT takes around 14, between maybe 12, 16 days of stimulation. And once that we have the embryos, we do the PGTA test. So then you should come again here to do the transfer, and then the material preparation in this case for frozen embryo transfer will take around 14, 20 days. It depends on if your endometrium gets ready and how you can like react to the medicine to prepare your endometrium. It depends also the timing. If you do an IVF without PGT, in this case, the treatments can take around 20 days. The first part of the stimulation, that was when we fertilize the eggs. It takes 5 days, so then you can do the transfer. So yeah, more or less the treatment takes around 20 days, but you can come to the clinic just maybe 5 for the egg retrieval and then for the transfer. In case of egg donation, the time can be a little bit more, taking into account the time of synchronization with the donor. It could last around 3 weeks and 10 weeks, more or less, from the moment that you start the synchronization to the moment that you do the transfer. Sometimes it maybe can take a little bit more because it depends on different factors. And as I was saying before, you should come here dependent on you twice or just one for the transfer. So this is more or less the thing related to the timing. Yeah, do you? Hello, Raluca. I'm reading your question. Thank you. Just a patient of 50 plus age. Unfortunately, we arrived to maximum 51 years old, but when the patient start the treatment, the patient should be 50, but like a new 50. Like if you wanted to start a treatment right now and you're just 50 run out and we can start. But if you're going to be 51 in 2 weeks, it's not going to be possible probably because it depends on the treatment that you want to do. We wouldn't stay in the edge of the age that we normally follow. So it would depend on this. And I'm sorry, but thank you. In the meantime, if you have more questions or otherwise we can speak to. Hello, Mary, thank you. Do you have Black African egg donor? Yes. A part of doing the matching with the patient is that we must follow also the ethnicity. And in this case, we can count with Black African egg donors to respect the ethnicity of our patient. Let's check it. Well, also speaking about the ethnicity, it is respected also like the well, normally, as I was saying before, the color of skin, the color of hair, and also maybe sometimes we can we try to match like the nose, the eyes, and not only the colors, I mean, but like the size, we can try to match in the best way the donor and the patient. That's why maybe at a certain point, we will ask you to send us some photos in order that the matching is going to be better and easy for us and for you too. Okay. Let's check it. Mm. Dude, I just get back to the presentations maybe in the meantime. Raluca, sorry, I didn't understand whether it's a patient of 50 plus 3 months using an egg donor. Thank you. Okay, 3 or 4 months, it depends. Like if you are a new 50, it means that maybe your birthday was, I don't know, 3 months ago, you could contact us and we could see your history and also your specific case at the clinic, and that we could see with the doctor if we can go on with the treatment. The thing is that if you're almost 51, so if you're getting 51 maybe in 2 weeks, this wouldn't be possible. Okay, Mary, I'm going to read your question. Thank you. Have you got experience dealing with fibroids about 4 centimeters? Okay, what happened when we are doing a treatment and maybe we see that the patient has a fibrom or polyp or anything related to this? If the patient has already fibroids and the doctor already knows and decide that the fibrosis is not a problem for the treatment and for the patient because maybe it is in a zone that does not affect directly to the transfer, we can go on. In other cases, if maybe it is something that we discover during the treatment, we always suggest to contact your gynecologist and check through maybe some exams to see if the fibroids or the polyp or anything that could be, it is in a zone that can affect the treatment. But yes, normally dealing with fibroids is something that can happen, but the thing is that we can find out for a solution and we can see together how to proceed. So Let's check it here in the meantime. I don't know, baby, if you could have any question on how you can get in contact with us. Also, today the webinar is in English, but we can count with a multi-language team. So maybe if you're connected today and you speak another language like Italian, Spanish, French, or German, we are able to help you directly in your language. This also helps if you live, for example, abroad. Maybe you're an English speaker, but maybe Maltese, you can live in another country, and our team is ready to read also all your exams in the original languages without the necessity of translating this. And another part is that a part of the just maybe the patient or the medical assistant, also the doctors are a part of being specialized in IVF and assisted reproduction. We have a team of doctor who speaks like more languages, so they can help you directly speak in your one. Good to see. I don't know if you can maybe have any question. Okay, we could experience that, Mary. How long is the wait for the transfer if you have to remove fibroids? I mean, healing process of the fibroid removal if you have to remove them. Mary, what happened when you have to remove fibroids? It depends on the how you remove it and also on the doctor that make the surgery. That's why if one of our patients needs to do this type of surgery while it is doing the treatment, we ask a raper to check, and depending on this, also one of our doctor can give you maybe a time, but maybe without knowing a lot of your case, we cannot be sure to give you a time. The thing is that once that is removed and the doctor that does the surgery says that you're okay to do the transfer, then we do not have any list of attempt. I mean, you can just tell us that you want to do the treatment, and we can start the protocol as soon as you are ready. Thanks to you, Mary. Also about speaking about the list, the thing that I was commenting right now is that you don't have to wait to do the treatment in Barcelona IVF. In any case, in the moment that you have all the results done, and once that the doctor says that you are ready to do the treatment, you can directly start. You won't need to wait for anything more. Once we are ready, we can start. Sarah, say I'm at your clinic with more specific question. Okay, perfect, Sarah. We're going to, we'll be happy to answer to your question. You can email us or you can call us, and anytime you can speak with a patient assistant that will help you, then maybe we can organize a visit and we can solve your questions. Thank you. Okay. I don't know, maybe if you can have more questions also about egg donation, if we have maybe any doubt or curiosity also, or also on the topic of today, which is the IVF with PGTA test, or badly anything. In the meantime, if it can help you, I can fix out the presentation. Here we were speaking about the indication for PGTA. Also, in this moment, if you want to share something about your history, we can try to see together if we can help with this. And in this case, also we can obviously organize a visit with one of our doctor, and we can try to solve it together. Don't be shy. Okay, let me check it. Sarah, can PGTA harm the embryo? Please tell me if in your mind that can like have an impact on your embryo. Is this what you mean? Like you mean that when we do a PGT test, it can happen something to your embryo or can like damage it? Yes, perfect. Um, what happened when we do a PGTA test? We were saying this before. We do a biopsy, so we take a piece of a DNA of the embryo in order to analyze it. It can damage early. Normally not, because we are pretty careful with doing this. The thing that maybe could happen, this is not directly related to PGT, but it could be related to the embryo. When we do the PGTA test, we do the biopsy, and then we wait for the result of the PGT. So when we see if the embryo is aeuploid, so okay to be transferred, there can something could happen to the embryo. There are some cases that happen that when we unfreeze it, the embryo cannot survive. But this is something that normally doesn't happen. This is something that can be really difficult to happen. Even if it can happen, it's not that common. So directly, the PGTA does not damage the embryo if it's done carefully also. But maybe in the moment that you unfreeze it. But as I was saying, normally it's not something that common. Okay. I don't know, maybe if you can have any question. We were speaking about the organization, the timing, and we can also work help people from abroad, but not only Europe. Sometimes we can also. I say sometimes because maybe it's not a common like having person and people from Europe, but when people comes from abroad, like for example, United States or Australia or South Africa or any country, I can say that it is really possible to organize it and also taking into account all the necessity of the patient, eh, and also from a logistic point of view in any cases of the treatment. Okay. Yeah. If you have also a more specific question, we can try now to solve it together, or then directly you can contact us to solve directly also with a patient assistant or with one of our doctor. So we still have some minutes. Get crazy with this. In the meantime, I can take the presentation if you like, so you can see some part of it. We can also do a little sum up. say this. I also wanted to comment to you that we always have a lot of innovation. We always have a lot of techniques to help you during the treatment. One of these is it was PGTA that we've been speaking about till this moment. We also saw what is PGTA test and why in some cases in women over 40 years old we suggest it because it may be when you're more than 40, we have an increased risk of chromosomic abnormalities. There is a lower natural implantation. Also, there are some cases, and sorry, which is in which we have a higher miscarriage rate, and we can improve like the time to achieve the pregnancy. And also, this is something that we were seeing together during this webinar that it also depends on what the doctor says and the doctor suggests. And once that you decide to do a treatment, we can see together also maybe asking you some tests and some additional things to solve better together your diagnosis. I see that somebody is writing. So let's check together for the question. Blastocyst culture. Can you have the 6-cell embryo reach a blastocyst? I only had day 3 embryo transfer in the past. Okay, so blastocyst culture, can you have a 6-cell embryo reach a blastocyst? I think that, Sarah, in this case, it is like a more specific question, more related to the division of the cell of the embryo during the days to arrive at blastocyst. So also in this case, I would suggest you to contact us so we can have a longer explanation and also a call because I see that you only had day 3 embryo transfer in the past. So maybe this as some causes that we can check together and also check with the doctors to see what we can do to arrive to a blastocyst or to find out any solution to achieve our goal. So we still have just 5 minutes or maybe a little less. If you have more question or directly, we can see maybe if we can speak and then organize a visit so we can make a special diagnosis and we can work together and achieve our goal as I was saying and as I've been saying during the webinar is as you prefer. If we arrived to the end, we were in a part of question and answers. This was like a little bit your turn. I also wanted to say thank you for your attention. Thank you for participating today. I hope that I helped you a little bit understanding our clinic, how it works, our techniques, how you can get in contact with us, and also in the moment that you decide to do a treatment, how you will be followed by our team, and also how the process works, how also the timings and everything related to this. So I think that we arrived to the end of this webinar. And as I said, thank you so much for your attention. And well, I hope to see you soon, and I hope to see you here in the clinic. Oh, If there's time for a last question. I see something right. Somebody writing. You can ask me. Oh, thank you, Christina. And I really hope to speak with you in the clinic. As I was saying, I'm a medical assistant, and I'm the second part of the treatment. So I'm the person who follow the person during the journey, also during the injection, and all this troubles related to the medicine. So I really hope to speak with you one day and maybe to see you here in the clinic. Thank you so much, and I really wish you a lovely night and evening. Bye.